What is your best advice or key messages for nurses working in an assessment center?
I think the biggest thing that we've learned through our experience at the COVID Center and through looking at other countries and their response to the pandemic is that access to testing is vitally important in order to be able to mount an effective public health response to this crisis. At the beginning of the pandemic, we in Ontario had a limited amount of tests that we were able to process, and so we had to turn some people away who were worried and who had some symptoms that could have in fact been COVID-19. And I think we did provide some reassurance, some education that whether you get a test or not, the management is the same because we don't have a cure for COVID-19. But more and more we're seeing the criteria for testing getting expanded, and that's really important, I think, and will prove to be key in moving forward in this pandemic.
Tell us about one positive experience you have had in your practice during this pandemic.
I think one of the biggest positive experiences, really a series of them that I've had through working during the pandemic, is that the public and the people who come to the COVID Assessment Center are extremely grateful and appreciative of the work that healthcare workers are doing, whether it's just through thanking us when they're leaving the assessment center, or telling us that they're relieved that they got some answers to the questions that they had. And even local businesses donating free meals and coffee to the staff at the assessment center. There's really been an outpouring of support, and I think that really helps all of us working on the front lines in terms of our morale and just knowing that people appreciate the work that we are doing, and because it is important work that needs to be done, and everybody plays a part in coming together and finding a solution.
What solutions have you found helpful in caring for clients within your community?
I think if this pandemic has taught me anything, is that when there is a growing public health crisis that is evolving as rapidly as COVID-19 has, there is lots of misinformation, lots of questions, and a really big need for education and communication. And I think those have been elements of the response here locally and at the COVID Center that have really helped the team build a more cohesion within the team. For instance, we have a morning huddle every day, and at the end of the day, we also have a debrief in terms of what's happened, what went well, how many tests did we do, and even sometimes it's just good to hear nothing has changed, we're doing the same as yesterday. Just some reassurance and some frequent communication is I think, vitally important